Wyatt Andrews begins our coverage tonight at the Capitol. Wyatt?
Good evening, Jeff. Yes, this was a very important day here at the United States Senate. Democrats finally passed their $871 billion health reform package, with many Democrats calling this the most important vote they will ever cast. Despite the controversial deal-making it took to get to this vote, Democrats called their health care bill an accomplishment far beyond politics.
This is a victory for the American people.
A victory, they argued, for Americans who have lost or who might lose health insurance.
We stand on behalf of 45,000 Americans who die each year simply because they don't have health insurance.
Most of the bill's consumer protections, including the right to buy insurance and no denials for pre-existing conditions, don't completely phase in until 2014. But others, including no lifetime limits on what insurance will pay, begin whenever a bill is signed. The president, in applauding the Senate, said reform will also bring more financial security.
On families who no longer have to worry that a single illness will send them into financial ruin, and on businesses that will no longer face exorbitant insurance rates that hamper their competitiveness.
Indirectly, however,
if passed,
the president recognized
if this legislation becomes law,
this battle isn't over, because the bills that have passed the House and Senate are quite different. Where the Senate, for example, would not even consider the public option, having the government offer insurance, 82 members of the House have said the final bill must have a public option as an alternative to private insurance.
Because it provides a competition that will keep costs lower. Without it, we will have a hard time voting for the final package.
And that's just a fight among Democrats.
Fortunately, Christmas Eve, not a great day for America.
Republicans believe that most voters are already opposed to this bill, that public support is dropping because of high costs and high taxes, and that Democrats will not be going home to high praise.
I guarantee you that people who voted for this bill are going to get an earful when they finally get home for the first time since Thanksgiving.
There was one moment of true hilarity when Democratic leader Harry Reid accidentally voted no against his own bill. But the laughter and applause coming from both parties was so good-natured, Reid later joked he was trying to show bipartisanship. And now, on top of everything else, the intense lobbying truly begins. Big business, for example, wants to keep the tax breaks it has long enjoyed in order to give drug coverage to their retirees. The insurance industry wants to lower the new taxes it now faces for high-cost insurance plans. It is almost as if at the end of this year-long battle, we're at a fresh beginning. Jeff?
All right, Wyatt Andrews tonight at the Capitol. Wyatt, thank you. Jeff Greenfield is our chief political correspondent. Jeff, and we should mention tonight, never has a piece of legislation this important passed with such little bipartisan support.
It's really striking. I mean, you go back to Social Security in 1935, Republicans voted for it by margins in the two houses of 4 and 5 to 1. Medicare in 1965, as many Republicans voted for it as against it. The Voting Rights Act, huge bipartisan support. The fact of the increasing polarization of the parties, that there are very few liberal Republicans and conservative Democrats, is one reason. But even given that historical trend, this is really striking.
So the question is, how long are the repercussions? Midterm elections, even beyond that?
I really think that unlike landmark social legislation passed by consensus, this is going to be a big political fight in 2010. This is going to be an issue around which the Republicans think they're going to get big gains in the midterms. And I just think it means that when a bill passed this important, with this kind of polarization, it doesn't end even when the bill is passed.
All right, Jeff Greenfield tonight. Jeff, thank you very much.
No,